speaker is Mr. James Neuenschwander.
Dr. James Neuenschwander. I'm a physician with dual board certifications in emergency and integrative medicine, and I've had the honor in the past 32 years of evaluating thousands of children. The parents of those children will, to their dying breath, say that it was a vaccine that caused their child to descend into autism. It was a vaccine that caused their child's neurologic disorder. It was a vaccine that caused their child's asthma, their child's eczema, their child's food allergy. I know there's a huge disconnect between what these parents are telling us and what you guys are teaching us. I also know as an ER physician, and by personal experience, ignore mom or dad at your own peril. But I'm not here today to debate the safety and efficacy of vaccines. I will, however, challenge each and every one of you in this room to that debate. I will challenge the CDC, the NIH, any university out there to that debate in a public forum. But I know it will never happen. The science isn't there. I'm all about the science. The biggest cause of vaccine hesitancy in this country is the lack of true vaccine science. I am here today to ask you guys in this committee to please, the community counts on you, do your job. I used to naively think that ACIP based all their recommendations on rigorous study of multiple trials that determined the safety and efficacy of each one of your recommendations. I've since learned that ACIP is simply participating in an industry-wide phenomenon I'm going to call junk science. Junk science has allowed, with all due respect to my colleagues in this room, presentation of these papers, of these studies, that would never pass the rigors of a peer-reviewed journal if they were on any other subject other than vaccines. I've watched junk science allow GSK to publish a paper on their MMR vaccine in which 10% of these healthy 12-month-old babies ended up in an emergency room in 6 weeks, and 2.5% of them developed a new chronic medical condition. But that's all okay, not because they compared that vaccine to a placebo group or a delayed vaccine group, but because they compared it to the current MMR2 vaccine. That's the moral equivalent of comparing 10 shots of whiskey to 9 shots of whiskey and a shot of vodka and saying vodka doesn't cause intoxication. Junk science also allows us to take vaccines we know don't work to just double down. Increase the dose, increase the frequency. I saw this committee in the last meeting look at the pneumococcal vaccine and say it doesn't work, and yet leave it on the schedule and leave it up to us to determine whether or not we give it to a patient. I'm sorry, but that's your job. Please do your job. We already know the mumps vaccine is of questionable efficacy. We know the flu vaccine at best will prevent 50% of the cases of flu in healthy adults. We know the MMR vaccine will wear off and you have adults who are susceptible to measles. We stand on a threshold of a public health crisis, and vaccines are part of that. But you guys can make a difference. If we don't change the course of where we're at right now, we will have nothing but chronically ill children and adults. We'll have epidemics of autoimmunity, of autism, of infertility, of asthma, of food allergies, of cancer. But you can change that.
As a courtesy to
demand
the speakers,
better science,
we ask that you conclude
demand
your comment.
better adjuvants, demand better vaccines. I thank you.
Thank you.